I was in pain. 30 volumes of hydrogen peroxide. Hi, in this video, I'll show you what happened in the first 72 hours of my rhinoplasty surgery. I've done a lot of research months prior to the procedure, so be sure to stick around till the end. But first, let's get right into the commonly asked questions. There you go. Pause if you have to, and let's get into the video. I never hated myself before, but I always knew since high school I wanted to have my nose done. I kept it to myself for years because I was always afraid to be judged. But hey, I'm 30 and life is too short to be anything but happy. You may say it's superficial, it's vanity, but you gotta admit to yourself, to feel and look beautiful impacts positively in many aspects of your life. Just a short background about me. I'm from Cebu, Philippines. By profession, I'm a chemical engineer. I also work part time in the crypto industry. I'm a pole dancer, performer, and an aerial instructor. Yep, I live a very active lifestyle. Hence, getting a major plastic surgery such as rhinoplasty is such a big deal for me, considering the budget, recovery time, and the post surgical care. I had my surgery on Alpha Advanced Clinic on September 1, 2022, but unfortunately, I wasn't able to record. I got anxious, I cried, I got nervous, but hey, I did it. Hi everyone, I needed a proper ring light while I'm cleaning my nose, so I might as well just, record it. There's really very few things that I could remember because I was sedated. Okay, so I'll just tell you what happened right after the surgery. So after I said goodnight to everybody, when I gave my anesthesiologist a go signal, okay, you can put me to sleep. So yeah, everything went black. I just remember just staring at the light, at the ceiling, and then just blacked out. I woke up like feeling having the longest sleep in my life. Maybe because I seldom get enough sleep, which by the way I'm trying to do right now while I'm recovering. My surgery started at 1 p.m. and then I woke up at 6, and I think the surgery only lasted for 2 hours. After a few minutes, I just felt so nauseated and my stomach was so upset because I haven't eaten since 10 o'clock last night because I was advised to fast to not interfere the anesthesia, I guess. But yeah, my anesthesiologist asked me to fast for at least 6 hours. Yeah, I think I over fast and I'm not very used to fasting anymore. What I did in the clinic, I think I'm just recalling it right now as hard as I could remember. I remember doing such embarrassing things like crying, asking for the nurse to help me. Like, I was in pain. Dili sa akong nose, dili sa akong ears. There was zero pain up to this moment. It's just my stomach. Nisuka ko sa reception area and naapay mga guests dito. The whole time I was bleeding also a lot sa ko ang nose. That's why daghan pa og mga coagulated nga blood diri nga ni harden na ni solidify na I was trying to cleaning them. For those who are considering to go rhinoplasty, never tell your surgeon nga ikaw na lang bahala doc, because you'll be very lucky if you turn out to be satisfied with the result, but you have to be accountable of the surgery, so you should try to do the best of the things that are within your control, and what is within your control is how you communicate with your surgeon. So yeah, I just tried my best to communicate to him like what I really want. What I'm just doing right now is just really religiously doing my cold compress, like more than what is recommended from me, because like I've been into fitness for long enough to understand the importance of cold compress and how critical the first few hours of your injury to administer cold compress. And this is no difference to any other injury. We have injured some muscles and tissues here in my face during my surgery, so I just try to cold compress the whole freaking time. And so far, I have not seen any bruising yet, but we'll see tomorrow. But I'm really expecting it to be minimal than the usual. There is no pain in my nose, but I can feel like a slight throbbing pain in my ear. I'm really wondering though how my ear would look like without a cartilage. They used the part of my ear cartilage sa ako ang tip sa ako nose, and then the rest of the bridge they are using Gore-tex. It is a bit more expensive than silicone, but considering that I have a very active lifestyle and based on my research, I think Gore-tex is just the right material for me because of how it would really incorporate or would really like bind sa imuhang tissues that would make it really, really stable. Hopefully though, this surgery turned out really well because this is going to be very difficult if not a corrective. How do you call that? It would be a repeat surgery. It would be very, very complicated na because by that time that it's okay to have a surgery back to correct whatever needs to be corrected, though I hope nga wala, it would be very difficult and it would cause another injury sa ako ang nose because the physical structure of Gore-tex is that it has really fine pores. As soon as it is inserted or implanted on your nose, ang imong tissue would grow into the pores of the material so that after a few months when it is fully healed, mura na siya nakabind very tightly and so well and set on your nose. So I'm done with cleaning my nose. So I just want to talk very briefly of the product I was using to clean my nose. It's in a 1:1 dilution with 10 volumes of hydrogen peroxide, and so far I just needed like 20 ml of the solution, so I add like 10 ml of hydrogen peroxide and dilute it to 20 ml. Let's go to my skincare routine that I have planned for the whole healing process because I cannot wash my face just yet. I want to keep this dry. I start with micellar water. I don't usually use for oily or acne prone skin products, but yeah, I am expecting that I would be goddamn oily the whole time because din ako maligo, guys. My suture removal would be scheduled 7 days from now. So 7 days ko walay kaligo. Oh my god, I'm such in my element. I had no problem with that. I am so friends with not taking a bath. Next is toner. It's a vitamin C toner that I've been using recently. The nurse actually told me to not use skin products just yet, but I don't understand why. Why not? But I think that she means that I shouldn't be using skincare products for the next few months just because my scars or my wound on my nose are still sensitive. But I guess if you just try to avoid that, then there will be no problem at all. Damn, I'm not gonna skip my skincare routine for a month. I'm such a boring person right now because I couldn't smile, I couldn't grin. Hi! Next is hyaluronic acid serum, just to keep my sad face moist. Right now, I couldn't really smile. I couldn't grin. It hurts when I smile, like a big smile. It kind of stretches my nose out. I'm just going to be like a very sad person for the next 2 weeks, I guess. And lastly, I'll just put my retinol cream. This gaming chair is going to be my bed for now because I don't wanna lie down just yet, just to keep my face from being swollen. So I'm just gonna sleep this way. We'll see how the back pain would be the next day. Just add more pillows to make myself comfortable and get ready for sleep. Bye, friends. So far, I don't see any significant bruising and swelling. I kind of feel like my eye area is a bit puffy, but overall, I love how I am healing. My cold compress is really helping me because I was religiously doing my cold compress. I would want to think that all the preparations I have made before the surgery has helped me heal well. I'm going to share that to you right now. The supplements that I've been taking, the changes that I have made in my diet. So number one is the bromelain capsules. If you have gone through the Facebook groups, you would see that people will be recommending you to drink pineapple juice. I did not really follow that, and instead I just took bromelain because that is what you want from your pineapple juice, the enzyme bromelain. And also I think that this is more cost effective because 500 milligrams of bromelain would require roughly about 500 grams of pineapple, and probably more if you are drinking pineapple juice. Also, I did not want to drink so much pineapple juice because I would want to stay away from refined sugars and extra calories while I am recovering. Most of the pineapple juices has sugar in it, and you don't want so much sugar in your diet because it promotes inflammation. And second is my arnica pellets. I was also taking this 4 tablets 4 times a day. Yeah, those are the supplements on top of my vitamin C. Now let's go to my diet. I was in a low carb diet strictly 1 week before the surgery and kinda not so strict 2 weeks before the surgery. I wanted to stay away from refined sugar as much as possible. Second is that I also try to stay away from coffee. I think this is the hardest part. I stopped drinking coffee 3 days prior to my surgery, and I'll probably stay away from it for the next month. No, I can't do that. Next 2 weeks. So yeah, those are the preparations that I have made, and before doing so, please consult your physician if you're planning to take the supplements that I've been taking and even the changes in the diet. This is me on the third day. I did not have much swelling and bruising, which is really good. I have not made any video when focused on my healing on the third day and the rest of the recovery days. I just try my best to eat really healthy food and get well rested. If you're recovering from rhinoplasty, keep your sodium low to minimize swelling. Avoid not just salty food but also processed food, because most of the sodium that we take doesn't necessarily come from table salt but also from preservatives and processed food. About 3 days after the surgery, I started to feel uncomfortable with the wound dressing. I remember taking one antihistamine when it got really itchy, but I found that keeping yourself from sweating and using a humidifier really helps with the discomfort. So I have already planned out my schedule to keep myself busy while recovering, both for productivity and just passing time. I have read the books that I always wanted to read but I didn't have time to do so. I learned few topics related about my work. Even the movies that I always wanted to watch, I already watched them during the recovery. This way, I have very little time spent worrying, and I keep myself preoccupied to be not bothered so much about the discomfort and the anxiety. That's it for this video. On the next one, I'll be taking you with me on my suture removal and seeing my nose for the first time. I really learned a lot in this journey. If this adds value to you, do hit that subscribe button and see you on the next video. Bye!